Erectile dysfunction is a serious problem, but many myths and misconceptions persist about this sexual issue. Men wonder if sitting on a hard bicycle seat can cause erectile dysfunction. They worry that erectile dysfunction may be caused by a diet, a lack of sleep, or simply part of getting older. They also wonder if they're the only ones with this issue. They are concerned about what to do to address this problem more efficiently, and the list goes on and on. They keep asking a lot of questions, and most of the time, these questions stay with no answers. That's the reason we are going to present the answers to a few questions to help you understand a little more about erectile dysfunction. Number 1. Can the prescription of drugs I take affect my erectile dysfunction? Yes, it can. Taking more than 200 drugs may be associated with difficulty achieving erection. Number 2. Can erectile dysfunction sometimes be caused by a psychological issue? Of course, especially in younger men. Erectile dysfunction is often related, either in part or as the entire cause, to psychological factors. Number 3. Can tight underwear cause erectile dysfunction? The answer is no. Causes of erectile dysfunction can be physical and/or psychological, but tight underwear is not among the causes of erectile dysfunction. At that point, don't mind wearing the type of clothes you desire. Number 4. Is erectile dysfunction a normal part of getting older? It can be a yes or no answer. It's common for erections to be more difficult to achieve with aging due to other diseases someone may be experiencing. But age alone is not a barrier to having sex. Generally, other factors may be involved. This may include vascular disease, diabetes, hypertension, and personal habits such as smoking and drinking alcohol. Number 5. Can a man get an erection whenever he wants? Not really. This may be true of teenage boys. However, erections don't occur as often as a man gets older. Hormones in a man's body and other life changes may affect a man's level of arousal. It may take longer for a man to achieve an erection and may require more direct stimulation and foreplay. But it's not always the case, because some older men may be able to get erect frequently, almost as younger boys, depending on their health conditions. Number 6. Can tobacco use, alcohol, or drug use lead to erectile dysfunction? Yes, it can. These substances can damage blood vessels and restrict blood flow to the penis and lead to erectile dysfunction. They can even develop other diseases that may lead to erectile dysfunction as well. Number 7. Is it true that most men never experience erectile dysfunction? Not really. Most men experience erectile dysfunction at one time or another. Studies suggest that as many as 52% of men between the ages of 40 and 70 may have difficulty with erection. However, it is hard to say that an older man can get a normal erection if he is in healthy conditions and take appropriate actions to address the probability of erectile dysfunction, for example, by keeping a healthy diet and regularly exercising. Number 8. Should a man seek treatment for recurring erectile dysfunction? Obviously, it is recommended. A man should seek medical advice and treatment if erectile dysfunction occurs more than half of the time. Although it is also a good idea to try some natural treatment to erectile dysfunction before jumping to medical advice. Check out the link of a video about this topic in the description to learn more. Number 9. May riding a bicycle result in erectile dysfunction? It's not really the case. This is a controversial topic, and some studies suggest that men who ride a lot may have compression of the pudendal nerve leading to erection issues. Riding a bicycle in moderation does not affect erectile functioning. Still, men should take breaks when cycling long distances. A bike and seat that fit ergonomically with a man's body can relieve discomfort associated with cycling and reduce the risks of erectile dysfunction. And number 10. If a man is affected by erectile dysfunction, can it cause problems for his partner too? The answer is yes. Both partners can suffer if impotence stays untreated. Failure to communicate and denial of the problem can lead to depression, anxiety, and lack of self-esteem for both partners. I'm assuming you got the answers to some questions which were burning inside of you about erectile dysfunction. I hope you get more clarity about this topic in order to make better decisions related to your situation. If you would like to know how to treat erectile dysfunction naturally, watch this video on the right side. Don't forget to subscribe to the channel, hit the like button and the notification bell so that you never miss out on any new informative video uploaded. Remember, your health is your priority. I'll see you in the next informative episode.